Hi, I'm Glenn McGinnis, host of Outburst on the Cable Public Affairs channel. Lately, we, like many others, have been doing things differently. We've been talking to Canadians across the country via Zoom about the COVID-19 pandemic and the issues surrounding it. We posed this question to Canadians. How useful is the information you're getting from federal and provincial health officials?
Teresa Tam is very wise, and I do trust her opinions. The Canada information site from Health Canada has been useful. So I think based on, how much things are changing on a daily basis, they're doing the best they can with the information they had at the time.
This is uncharted territory for everybody. And so I think it's important that our health officials are providing us with all the information that they can. And I think it's important that we listen to them. Each day for them is as new for them as it is for us. And they're providing us with key information. And as long as we follow that, I think we should be on the straight and narrow.
We are getting it on a daily basis, and it's coming through a variety of means. It's coming either through the television or social media or online venues. So it's hitting a wide variety of age groups.
We're lucky here in Nakawik, small population, it's easily social distance, but from what I understand in larger centers, people are not wearing the mask and sort of refusing to, not social distancing. So you have great information, but you have to actually do something concrete with it.
They really don't know what they're dealing with here. And, when this first started, it was one thing, and then a couple weeks later, it was another. And then, it's such an evolving situation that, they know, but I truly believe they know as much as we do right now. So any information that they get, I sort of hang on to as both a citizen and as a business owner. But I feel like it is inconsistent, but I also don't blame them at the same time.
A lot of my information is also coming from individuals I know who are doctors or nurses or working in the healthcare system, and they're really echoing a lot of what I'm hearing from the provincial and federal government. And so those are the ones I want to trust. I'm not a healthcare professional. I'm also not a politician. And so to some extent I need to question it, but I also need to trust because they're the ones who are trained. And so I have appreciated it. It's been helpful for me.
I think we're getting very useful information. I think everything that we've been told so far is keeping us just enough in the loop that at least we know how to take care of ourselves and how to protect our families. I really think that they're doing a really great job with what they know, and it's a learning curve for everybody. So, I don't think that they're holding anything back from us.
They're trying to figure it all out as well, and I feel like they are getting the information out to us as soon as they can. We're having live conferences with our premier and our chief medical officer once to twice a week with updates for us, and I think that's wonderful. And every single day there's updates for the nation. So I think it's good. I think they're trying to get the information out to us, and we have to do what we're supposed to with that information.
What I find interesting and refreshing is that we have parties from both sides of the aisle, meaning our Prime Minister and, of course, Mr. Ford, the Premier of Ontario, in lockstep in the sense of they both see this as very serious, and they're, pretty much united in their approach on how we handle this. So that's refreshing.